I started hemodialysis, I was nervous, and so the person beside me in the chair said, this is what you're going to expect, and this is kind of how it works, and I was very appreciative of that. During my time, I also saw patients speak up, and ironically, the person who's beside me in my chair spoke up to say, "Hey Meshia, do you see this technician, how they're taking off their gloves in between different patients? That's what's supposed to happen." And so if you don't see that happening, or if you don't see that the machine is being wiped down, you really need to speak up, because that's the protocol, that's what's required.
I wasn't as knowledgeable about kidneys as I am now. I didn't realize that what the catheter is, which is basically an expressway for bacteria to get into your bloodstream.
I will say that doing in-center hemodialysis, there's chances for infections there as well. I can attest to that, as I had an infection. I had a catheter that was placed in my chest in the very beginning of in-center hemodialysis. Unfortunately, I got a really nasty infection with my catheter. It was an infection in my bloodstream that caused me to be in the hospital for about 2 months, and I was really, really sick.
It's in a patient's best interest to make sure that they wash their own hands thoroughly using the proper technique. It should take about 30 seconds to wash the front and back of your hands with nice soapy water. Rinse it off. Rinse the access site wherever it is. And also ensure that the technicians that are taking care of them and other patients are doing their job by following their hand washing and sterilization techniques as well. And don't be afraid to ask them to change their gloves. If they have a problem with that, go to the supervisor. If they don't want to do that, they can call the network, their ESRD network, for whichever network they're in, and they can report an issue there.